Hello mga Dokis, lahat ng mga
Hello
nanunood
mga Dokis, mga
sa Usapang
Papaps, hello.
Dentista.
Yes, hello.
Hi!
Hello po sa
Good
mga dentista.
afternoon.
Hi.
And
Good
on
afternoon.
the area of our special guest today, good morning. Ayan.
Good morning.
Yes. So anyway, this afternoon, Doki Bry is going to
Mhm.
be an exciting one because we have been promoting facial aesthetic in the field of dentistry for some
Okay.
time now. Diba? We
Okay.
started last year and then COVID is still, quite
On the height of
high. Yes.
COVID, yeah.
And so luckily in 2022, it went down and whether we like it or not, everybody is opening already. Otherwise, we will all die in hunger.
Yes. Talagang kailangan na doktor eh.
Yes. So that is why
Grabe po talaga doktora yung tagal ng
yes, I
COVID.
know. And this is exciting, Doc Brian, because as you know, we are also trying, our channel is dealing not only with Dockies, but also Mamaps and Papaps. But recently, our topic is more geared towards the Dockies. Yeah, because alam nyo mga Mamaps and Papaps, it's
And
very important
Papaps.
as
Yes.
well that we are able to try to improve the practice of dentistry, especially
Yes.
in the Philippines. Ayan. Di ba, Doc Ibray? So,
Totoo yun, doktor.
without further ado, ayan, we will of course have to introduce our special guest who woke up really early today in
Totoo yun.
order to be with us, di ba, this afternoon.
Sobrang na-appreciate ko to na napaka-aga niya right now, to be honest. And I'm really happy that he gave us her time, kahit sobrang busy niyang tao, para maasikaso at ma-answer yung mga questions natin. Di ba, Doktora?
Yes, oo. So, our special guest
Mhm.
for this afternoon, I think you have seen her in some of our also collaborative partners, 'di ba?
Yes.
With allow me to have this opportunity to thank yung mga talagang influencers. Tayo kasi on the side lang, on the side lang tayo. So, of course, we really appreciate Dr. Arky De Leon of the dental
Thank you, Dr.
architect,
Archie.
yes, who has interviewed also our guests for this afternoon and morning on her part. And of course, Mr. Roche Ruiz, which is also our other mentor in our DMD Center DESC or Dental Enhancement Skill
Your
Class.
class.
Yes, na-interview din yung aming special guest. Now, our special guest has practiced facial aesthetics, not only in the field of dentistry, but outside of it for more than 20 years. Ganun na katagal. Ayan. And she's one of those who pioneered doing facial aesthetics in the field of dentistry. And she has a practice in London. And I met her in one of our training in Austria, and she actually demoed doing facial aesthetics. And I learned that she is offering trainings through the Academy of Face Design in
London.
UK.
Yeah.
And because I'm trying to find ways, especially, di ba tayo, Doc Bright, we are trying to find ways to improve the practice of dentistry, especially in our country, which is the Philippines. We decided to do this program. And in order for everyone to get to know her better, okay, so syempre, dito naman sa channel ng Usapang Dentista, natin siya i-interviewin. Ayan.
Totoo yun.
So, mga Dokis, as we go along, wag nyo lang kalimutan to support our channel kahit hindi kami consistent. Give us a thumbs up if you like the video. And then, of course,
share sa mga friends at mga
share.
co-dokis natin. Kailangan nilang makita tong balitang to, Doktora.
Yes, yes. Share and do subscribe in our channel. And so, without further ado, ayan, dahil nga we will introduce her na. Okay, so without further ado, let's all welcome Dr. Ivona Igerc.
Igerc.
Yes. Ayan, Dr. Ivona, pwede
Ay,
mo
Dr. Ivona.
There you
Hi.
go.
Good
The
morning from
beautiful
London.
face. Yes. So
Thank you for
greet
inviting me.
we are live, so do greet everyone. Go
Hello,
ahead.
everyone. I'm super happy that you're all with us in this interesting live stream. And we have beautiful topic for this day. We talk about facial aesthetics, and this is a hot stone for every one of you listening. Being a patient or being a practitioner, either ways. Yesterday, I was watching an interesting channel on American television, and at the end, there was a moderator who was 25 years old. There was a moderator who was 35 years old, and the third moderator who was 45 years old. And at some point, the doctor had to guess what is the age of each moderator, and the doctor failed. So we come to the world where we can't say age anymore. So better to be part of this world now than later.
Yes, and that is why, Dr. Ivona, we have 5 interesting questions for you, because as you know, people have a tendency of short span of attention. So
Yeah.
we don't want it to be very long, and we want to get the most out of your, expertise in this field. So let's go with the first question. Okay. So the first question. Yeah. So,
First
Dr.
one.
Ivona, we will be discussing what went wrong. And what we are going to ask your opinion. These are Hollywood stars. And just a disclaimer for everyone, it doesn't mean that Dr. Ivona is not the actual doctor of these pictures or, known stars. But we would like to ask her opinion in regards to if she is the doctor, what can she advise in order to make it even look natural. And as you
How
can
can she
see,
improve the whole treatment, Doctora, right?
yes, as you can see in the photo, Madonna. Ayan. So Madonna is during my time, di ba? Right, Dr. Ivona? I think
Yes, during our time.
yeah, during our
Kung isa
time.
ka oras,
So
Doctora, it's not my
Madonna
time.
was big.
yes.
Yeah.
So anyway, sa Madonna. Okay.
Yeah.
So
Yeah,
okay.
Madonna in our age. So Madonna, when we were young, Dr. Jean, I used to dance on her songs. We had a little group. So this is Madonna when we were young. Then we have Madonna in, I think like 10
I think
years
in the
ago.
mid-range.
Yeah.
So anyway, Dr. Ivona, what can you say about what do you think she has done in her face and in terms of fillers and Botox? And if you are the, the facial esthetician of Madonna, what
How
do
would
you
you do
think?
it?
To make it more natural, like nobody can guess that she had something done. Okay, the floor is yours, Dr. Doki.
Thank you, Dr. Jean. So here we see our Madonna when she was in, I think like maybe 30 years ago or 25 years ago, then 15 years ago, and then how she looks recently. The thing is, obviously there is something done because she looks still young. Maybe on the second photo, somehow the transformation is more natural than on the third photo, because what it usually happens in the world of facial aesthetics, if we don't know how to say no and cut our patients, even though they have huge wishes to improve more and more and more, we get into this accumulation of hyaluronic acid and people start to look a little bit unnatural. Regarding this picture, what I would like to stress out, the most important thing for our delegates or our dentists who are watching us now is to know the anatomy. That's number one. Really deep into anatomy. When we know anatomy, we know how to work and how to handle the face, how to control the face. Because beauty is like a wild horse. If you run, the wild horse is the best feeling ever, but you have to control it. Otherwise, you crash down like it happened in the third picture. So beauty is on the edge, and they jumped over the edge for a tiny bit. And when this happens, immediately we see that something looks a bit wrong. I would not say even wrong, but that the face looks done. The beauty is in little details. So when we observe the face in these little meticulous details, then we will never cross that border. And this is all what you're going to learn, how to handle the face, when we have to say no. And in this case, I guess we will need even to dilute a little bit and then to do some rejuvenation treatment because the face looks a bit dull.
Okay, Dr. Ivona, like for example, I'm excited that you're coming on December for actually 13, 14, 15, and we will have a workshop and I will be one of your patients. And I think I am of the same age of Madonna on the third picture. Basically, I think the mistake done by most injector is that they totally remove the groove on the nasolabial to the point that, you know, like for me, I already like this one. I just want this one to look like this one, you know, something, like that, right? So, because sometimes if you remove the certain characteristics of the face,
it looks
that
unnatural.
totally makes like you really had done something.
Yes.
Like on her part. They say
Too
that if
much.
they have a Joker, you can see the Joker smile.
Well, what I think personally that went here wrong, that they were overcorrecting that nasolabial fold, and then there was a little bit of migration of the filler into her cheeks. Probably, we have to have a big disclaimer here.
Yeah,
because the person alive, there is a lot of photoshops going on.
Yes.
But I can just comment that dilution of that area would help a lot. That she looks more natural because lines have to be on the face.
Yeah.
The idea of beauty is not to airbrush the face, but to leave the mimics and bring out this anti-aging effect. So just put her back in time, like 10, 15 years, but with her natural expression. She must move that face. Otherwise, it looks weird, especially when smiling and nasolabial folds are not there, or smiling, and smile has to start in the eyes. And then when you have the frozen eyes and big smile can really look very weird.
And I think she had something like, you know, a stretching here because her jaw, her chin
is
become longer in the second, right?
Chin is too pointy because again they were probably exaggerating with botulinum toxin to masseter muscle, and the chin, you know, came out like a bit witchy, I would say. And then also this area around her eyes is very tight and frozen. So it all has to be more relaxed, more natural, more movable, more into dynamics and expression of the face.
Okay, Dr. Brian, introduce the next picture.
So it's Renee Zellweger, Doctora, a famous actress in US. So what I noticed, Dr. Ivona, is I think what happened with her eyes? I don't know what happened with her eyes.
It's Dr. Brian here, again, a big disclaimer, but what I think here was also a little bit of surgery involved, I must say. So what really happened is probably one stitch facelift first. This is some new way of doing facelifts, and they slim the face a bit and they bring all these fat pads very close to the nose. So she looks puffy. She, on the first picture, is her natural face. You see that it's more wide.
Yes.
And position of her eyes are different. So after probably, let's say that she did this facelift surgery, one stitch facelift surgery, she got like all accumulation of her fat very close to the nose and repositioning of her lateral eyes, eye corners, eye contuses. So that's why she looks, I would say, quite weird.
More closer than before.
Yeah, too close because the face got narrower, because the lift was done probably here. You see, I would also look weird. Everybody would look weird if you do the lift here. So it's a temporal lift, which was lifting the lateral canthus of the eyes together with the temporal, medial and lateral temporal fat pads. And then the face tend to look quite slim and overpacked. Probably a few fillers done more into her mid face, so she looks puffy, and then the eyes immediately look a bit strange.
Yeah, she looks totally different already from the second picture. And sometimes too much cosmetic surgery tends to lose what they really look like originally and why their fans love her. She's one of the movies, Dr. Ivona, of Bridget Jones. I don't know if you watch it.
Yeah, I love Bridget Jones.
Yeah, I'm
a huge fan.
Yeah, and the famous partner of Tom Cruise, the saying, "You complete me." What movie? I forgot. But anyway, she looks totally different. Okay, the third act this time.
About this one, Dr. Ivona, what happened?
Men aesthetics,
yeah. This is Zef Afron. And how many male patients do you have, more or less, in percentage in your practice?
Well, I have more and more men patients. I was one day working just with men, full day block, 25 men. And I would say first we thought is around 25%, then we come now nearly to 38%. Because men, they also deserve to be handsome, right? It's so unfair in this world to have just beautiful women and we're the men. So I think men as patients, they exactly come in the clinic, they exactly know what they want to do. So there's so much into details, you would be surprised. And there is no mess around. So you put the numbing cream, you do anesthetic for them, you do exactly what they want, they watch in the mirror, they're okay, they go. Men are very easy patients because they really know what they want to do. So here, in this picture, I must say that probably wish of Zac Efron was to do the jawline, because this is the typical wish of every man patient we have. So they want to have this exquisite and quite prominent jawline, which on a way is connected to their masculinity. And here, as you see on the second picture, so when you see the width in between masseters on the first picture and the second picture, is much bigger, right? Much longer width. And probably again, we have to calculate the face. We can't just make jawlines how we want to make them. We have to know exactly and very precisely how longer we can go. Otherwise, people tend to look strange, a bit like robots, right? Especially men. They like angular look, but here we have to be very careful not to go into too angular definition like it happened here. So he is too angular, and the chin is not connected with his jawline or with mandibula. So chin tends to, smile in movement, tend to kind of be exaggerated because it's not blended on a perfect way. So I think here the injectables were really not used correctly, because in order to make him more man, more powerful, he looks a bit weird. He looks like he has, hypertrophic parotid glands or something.
Yeah, they do.
Okay. So is that caused by Doc Ivona, also for the mom-ups and pop-ups? Can you do the Botox and fillers in different places of the face at the same time, like one sitting? Like if you like to do the glabella, the nasolabial, the lips, the jaw, can you do that in one treatment or separated?
You should do them. The Botox is always better to be done at one go. Then after 2 weeks time, people come for touch-up, your patients come for touch-up, and then it's over, because botulinum toxin has its own dynamics, which we have to respect. And if we kick in with botulinum toxin in a different way than we should, we can provocate our immunity system, and people will be immune. Our patients will become immune on botulinum toxin type A. So it's better to do it at one go. For novice injectors, they usually do it maybe in first time and then after 2 weeks time, because just to be more secure, I would say first 20, 40 patients, but then later on, you ideally want to do it in one go and not overshoot more than 250, 300 units of botulinum toxin, because again, can provocate out our immunity system. Even though I was checking a new Botox last week, which is apparently not in any interaction with our immunity system. So this could be something new on the market, but it need to be tested well, and yeah, we will see how it works.
So can you, like, for example, on his part, is there a filler you think that was?
Oh, there is. Okay. So if I need to explain what was happening here, so he got a lot of filler into his jawline, mandibular angle here, into this chin. Then he got also into the cheek area, because you see how his cheek area is fluffy, and they didn't correct correctly also the area under eyes. Tear throw area is not corrected properly. Then when we watch his botulinum toxin, it's not, again, could be done much better, because for men we need to leave some lines, not something in between line and no line. So it's quite visible that he did a lot of botulinum toxin in his upper face, because we have some kind of wrinkling there, but not proper wrinkling as well. So the way how to hide botulinum toxin is to leave few wrinkles, not to completely freeze the face, and then moving of frontalis muscle is still producing some imperfections on the topical skin. So I think, yeah, being this kind of actor, he should be done on more, I would say, precise.
My question is this, can you still reverse that situation, that look? Can you still like fix it? Is it still
with
fixable?
botulinum toxin, or you mean with the dermal fillers? Both.
We'll discuss that a little bit later, Dr. Brian. But the first thing, Dr. Ivona, how long is the effect? Let's just say, for example, you really like the result. Okay, like either Botox or fillers. So how long is the effect for Botox?
Well, botulinum toxin usually lasts 3, 4, up to 6 months. I would say after 4 weeks, it starts to decrease in its power, and depending on metabolism of our patients, it wears off. So it's quite short. Everything beautiful lasts very short. Okay. And then we have dermal fillers, who ideally last around 1.2 years. But I would say we should not think about that. We should think how to manage the patient, because if we get this beautification, which is making our patient happy and we are quite satisfied, then we should bring this patient into management. We should control the patient every 6 months. We should kind of, refresh all his looks or re-enhance him. And that's the way to go. Not to say to the patient, okay, now you're done and see you after 1.5 years, because then we have to start from the beginning. And remember, we do age, so our job is going to be much harder, and we will never come to this perfection of aesthetics. Beauty is in discipline. Discipline for foods, discipline for exercise, and discipline for maintaining the result. So our patients ideally should be into maintaining period after injection.
Yes, normally, Dr. Ivona, you said maintenance. So in terms of Botox, when is the best time to do, just a touch-up, for example? Because sometimes people get addicted to it.
Yeah, that's a good expression. They really get addicted, and they start to call you in the clinic. Oh, my Botox is not working well. But in the moment you explain to the patient that basically Botox does wear off and that they should come back to the clinic, ideally, I would say after 4 months, 5 months. We don't need to overshoot with anything. So less is always more. And more we do it, we need to stretch Botox into the longer periods. So ideally, I have my patients after 6 months, because I want their muscles to move. I don't want that they are always ultimately under effect of botulinum toxin, because this can provocate in long term also atrophy. We know that muscles are very tiny on the face, so we have to let them move and let's say, ideal is that my patients are like 1 month at least, or 1.5 months Botox free, which is nice also for them to control the anti-aging results of Botox, because I have patients long term now, maybe 10, 15 years. And when they came to me, they had wrinkles when they were Botox free, but now there are no wrinkles because Botox is also working nicely on the anti-aging effect during the time.
Now,
For filler,
for fillers, Dr. Ivona, they say there is an accumulative effect. So
there is.
basically, if you're going to do a touch up on that, what is the ideal time to do a touch up?
Well, ideal time to do, I always have all my patients in control every 6 months, no matter what. If they need before, they come by themselves before, because maybe they have some special events or things like that happening. But every 6 months, I have to monitor their face, understand their metabolism, and find the right moment where to re-inject. Sometimes I send them back home and they come back again after a month, because I think that's a better timing. Probably because what you said before, accumulation of hyaluronic acid. It's not a big thing right now. It's not scientifically proved, but what we see out of clinical practice is that there is this little tiny hyaluronic acid left, or we are even not sure if it's hyaluronic acid which is left, but our fat pads and our muscles got reprogrammed. We all know that we have muscle memory. So when there is something which is kind of supporting the muscle, because the muscles in the face are very, very tiny, they're probably starting to look different and also have different tonicity. So we are really not sure what's really happening now at this point, but we need to be careful with not over injecting our patients. For this, we always have time. If we over inject, we can dilute, but I guess much better approach is less is more. Monitor, and maybe a little bit of filler there, or a little bit, tiny bit of botulinum toxin there, because beauty is on the edge. When we cross that edge, people start to look weird.
There's no turning back once you
Yeah.
go there.
Yeah.
Anyway,
So,
my question is,
Dr.
Ivona.
Brian, here's your question earlier.
No, Doctor, this is a different question, Dr. Ivona. My question for Dr. Ivona is, will it affect, will the longevity of the effect be changed when it is applied to a hyperactive muscle? For example, the hyperactive masseter, then you put Botox or fillers on it. Will it change because it's always being used or always been?
If the muscle is changing, sorry, is it the muscle?
No,
Yeah,
I
well,
think, Dr. Brian, no, like what you've said, when you have too much Botox, because the botulinum toxin is like arrest the activity of the muscle, right?
exactly,
And that's
exactly.
why you said there is a possibility if you have too much botulinum toxin, it might result to atrophy.
Exactly, precisely
Yes.
so.
So,
we have
Dr. Brian, what was your main question, or is?
Yeah, my main question is does the longevity of the effect of Botox or fillers changes when it's applied to a hyperactive muscle? Like for example, remember the photo earlier, like you have very, very big masseters, like this
Yeah.
guy. So if we always like use it and
So he probably did his, we don't know for certain, but we can guess that he did here dermofillers to make this jawline really intense, and not botulinum toxin. So in his case, if we dilute the dermofillers, he will go back to normal. So it's very simple to bring him back to normal. With botulinum toxin is working on the long term. So if you inject into masseter muscle, the face is really looking slim. And at some point, it's irreversible because you will not be able to bring back the same amount of muscle you had from the start. But what we ideally even don't want, because there is certain tonicity which every muscle in our face has to have, so that everything works like Swiss watch, fantastic, and bring out all these beautiful aesthetic effects.
Okay, thanks, Dr. Ivona.
Okay,
No.
so like what Dr. Brian earlier is asking is, if you made the mistake, let's
How
start
do you correct
with
it?
botulinum toxin. Because mga mamas and papaps, Dockies, Botox is actually a brand. So the generic name is botulinum toxin or
Toxin.
Bonta. Am I
Yes.
right? Yeah.
Botulinum toxin type A, that's why Bonta.
Yes, yes.
But you're
So
very
Bonta.
right.
Yes.
Yeah,
So how do you correct it if in case in
toxin.
a botulinum toxin, the docky made an error of too much injection or injected it in a wrong area? So
Ah,
do you just wait until the botulinum toxin, dissipate, or is
yeah,
there a way?
yeah, that's a smart question. So with botulinum toxin, or either you wait and then if it was really too much, then probably you have to wait at least a month that it starts to wear off. But normally what I love to do when I need some correction is to play with the other group of muscles. So the muscles which are antagonists to the main muscle which was blocked. So for example, if I put too much Botox into the upper facial third, so I would like ideally to open more orbicularis oculi. So then I will, when the patient comes for the revision, I will inject more into the antagonist muscle. So let's say droppage of the lip corner. If I inject too much into the pressor anguli oris and the lips go too much high, so then I have to inject a little bit of botulinum toxin into antagonist muscle, which is lifting the lip corner down. So this way of thinking we have to have when we deal with botulinum toxin. That's why I said at the beginning, anatomy is crucial. When you know anatomy, you understand everything on the face.
Okay, so how about fillers, Doc Ivona? If you put too much or
Yeah,
it went somewhere else that's not supposed to go.
migrate.
Yes, migrate. So what generally is the solution of
Approach is
the
to
practitioner?
dilute the filler. It's very easy, It's like we have another injection, hyaluronidase. It's like Pac-Man eating the filler. So basically, we can very precisely dilute this what went wrong. So you see, there is not a big problem here in controlling of complications, I guess. If you know your anatomy, you can wiggle around, you can find your way around botulinum toxin. But if you have good skill of dilution, you can remove hyaluronic acid from the face and people come back to normal.
Okay, so this I think is really, the most common thing that dentists can do,
Gummy
and
smiles,
that's
yeah.
gummy smile. Yes. So basically, Dr. Ivona, how long, is the treatment of gummy smile?
How long it lasts?
No, but the
Yes.
treatment is you have like different. Can you control immediately the gummy smile in one injection, or does the patient, is there going to be a next
Follow-up
injection or
treatment.
something like that?
So it's beautiful. Now I have a lecturing this Friday on a big congress just for gummy smiles. And I will be together with a person who is very famous in Europe. So we will have together lecturing, and she is doing all the surgical corrections for gummy smile. So it will be like, different approach, different angle on looking. So when I was doing dentistry, I used to be periodontologist. And I was very, very much into gummy smiles. So the surgery you're doing for gummy smiles, quite tricky. Diagnostically, you need to understand really very well what you're going to do, elongate the crown, or, go into maxillar surgery. And there is a lot of things to consider. But here in gummy smiles, with botulinum toxin, it's quite simple. When you think that this lip is too short, you can really first know diagnostics of gummy smile. For example, this gummy smile was quite large gummy smile, and this is class 3 gummy smile. Class 3 gummy smile goes always with certain muscles which need to be injected, and you just very simple. In 2 minutes time, boom, 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 you inject the muscles, patient is going home, coming back to your clinic after 2 weeks time for correction, and everything works very, very, very well. So less is more. You under inject the patient, and when she or he is coming back after 2 weeks time, ideally you top up or you re-enhance if you can, or sometimes you just do nothing. And that's it. It's a fabulous treatment because patients don't have any downtime. They're not traumatized because, after the surgery is how it looks really. They're eating on the straw, losing their weight, and everything is very, very painful. And these gummy smiles, surgical, are never corrected to absolute, you never get this absolute enhancement like you can do with botulinum toxin, because botulinum toxin goes into such a big precision of every single little tiny muscle which is lifting the lip. So I think it's a beautiful and must-have treatment in every dental office.
Yes, and that is why, speaking of our talking of Gummy Smile, we would like to invite our dockies out there to attend our facial aesthetics in dental applications this coming December 13 at the AADS convention. Dr. Ivona here will be here in the Philippines. And she will have a lecture on the main convention, and then of course our filler workshop in the afternoon. And then of course, speaking of Gummy Smile, Dr. Ivona has really taught this in one of the modules of our advanced online program. But mga dockies, the first step in our facial aesthetic training program is doing the foundation online program. So if you cannot attend anymore because of the requirements, just like Dr. Ivona said, you really need to learn and have the knowledge of anatomy. And this is where you're going to learn so much about anatomy in our online program. And then, of course, this is 4 parts, mga dockies, so that you will learn the foundation knowledge, and then the advanced, and of course, the workshops. Now, mga dockies, if you are not able to enroll with us on the workshop for December, don't be sad, don't despair, because we will try our very best to bring Dr. Ivona back for the next workshop. You will be able to enroll with us. Ayan. So, Doc Ivona will be the one to teach you how to do it. Okay. So, the next part is the next question is, when you were starting, Dr. Ivona, how can you convince a patient you are the right person to do the treatment? Because, of course, they think that a dentist, and they are so used to going to a dermatologist or a cosmetic physician. So when you were starting a long time ago, I know it's a it's a long time ago, but who is your first patient, and how were you able to convince this patient?
Well, when I started, my first patient was my mom.
Oh, really?
Amazing. She had all the patients in the world. She's also a dentist. She, at that time, did not approve it at all. Did not, because she was a high positioned, like, dental politician in the country, and she used to be dean at the medical school. So she was like closing the eyes on what I'm doing, but she was a mother who was supporting me. This I will never forget. So she and my friends were the first one who somehow gave me possibility to work on their faces. But I think I was quite confident from the beginning, because I was really truly believing that who can enhance better the lower facial third than a dentist. So there is no dermatologist who knows so well how to do the lips, lip corners, how to balance smiles. So if I would start again, now I would say to my patients that I have huge knowledge of anatomy, that I have this syringe every day in my hand, that I know very well that there is no one else in the world who knows better smiles than me. and that I can, and that smile, like you, Dr. Jean said, on a beautiful way, and I'm using your quote all the time, smile is skin deep. It's
Yeah,
not
yeah.
deep.
That's
Yes.
true.
There's so much more of a smile out there than just teeth, and who can do it better than me being a dentist? And then I would be also prepared to have some little pictures before and after of your own mother's friends whom you injected before, because don't go to a
Ah,
private patient before you injected your friends. Some nice pictures and show to them. But I
yeah.
think the most important thing is that that patient is already comfortable with you doing your dentistry. And then he will not doubt. He will be very happy that you inject his lips. So I think for you, all of you there, who are dental practitioners, important is to get your loyal patients who are happy with their veneers, and they will be more than happy to get some more improvement there on their smiles.
So what is the anatomy, Dr. Ivona, that you first injected? Not with your mother, but with the real patient, because of course your mom will forgive you, but
Yeah,
yeah, a paying
patient
patient,
never.
yeah, a
Well,
paying patient will, you better do it right. So what is the anatomy that,
exactly.
yeah, you first injected?
Lips,
Ah, the
nasolabial
list.
folds, marionette line. That's why I made it in our foundation course, Dr.
Yeah.
G, because I think that's the way to start for a dentist. And then later on, the patients will ask themselves, okay, I have some lines here on the forehead. Can you do it for me? And you will happily do it for them. And but I think smile and lower facial third, perioral area, this is something where you can very easily convince your patients, and this is something where you have to be the best.
Okay. So, Dr. Ivana, another question. Can a dentist really do facial aesthetic outside its anatomical?
Anatomical domain.
Yes, because as you
You mean,
know, it's very controversial. Unlike Europe or US or other much progressive country, in Asia, it's more dentists are more conservative. Well, probably different in South Korea because
for
they're
sure,
they're the center of
of beauty.
beautification. Yes, in Asia. But do you think that dentists can also do it outside the lower two-thirds? I mean, like you're a dentist and you are able to do it already outside the area of the facial. So when did you started doing outside the dental area?
Times. Well, I started to do it quite quickly, but I would say for because I was in the situation to do it. I was also doing medical trials. I was injecting those injections everywhere to understand how long is their longevity and the quality of cross linkage. And so I really had a lot of skill and a lot of possibility to quickly go outside of this perioral area. But I think with our workshops, everything is planned for the dentist. So first workshop, the dentist will learn how to do perioral area enhancement and botulinum toxin on the upper facial third. So here we already go somewhere outside of the perioral area. And then second workshop, we go and talk about mid-face, jaw lines. So it's all planned for every of our delegate how to do and when to do which step. And we will be very precise when we finish the workshop, and we will ideally say, okay, now you have to inject 20, 40, 50 times into certain area. We have also, Jean, in England, I think that could be very interesting for the dentists in Philippines as well. We have a follow-up mentorship program where dentists every month have certain assignments. They inject, they have with me a little bit of a chat room so that we understand precisely how to inject certain patients. Then they do the treatment. Sometimes they are again monitored by me. Sometimes if they're more advanced, they feel free to do it, and then we discuss the pictures after. I think that's a brilliant thing to make everyone working and to make everyone really confident in what they're doing. Yeah, but I think generally with all our program, they will be very much leaded into when to start to inject which part of the face. Because at the end of the day, we talk about 43 muscles who are over connected. So if you do perioral area, if you enhance smiles and the gummy smile starts in the eyes. We have to correct the muscles around the eyes and the way how people are smiling, right? Because ideally the aperture of the eyes has to be big enough. The worst thing is when the cheeks bulk over the eyes. So you can have the best possible smile there, but if you did not correct again the area around the eyes and smile starts in the eyes, you did not get the 100% beautification of the smile.
Okay, so Dr. Ivona, in Europe, when did it start, for dentists to be able to do outside the oral? Because of course here, just the oral area becomes very controversial. So what more if you go to the eyes, as you
Outside.
mentioned,
Yeah.
So when did it like expanded that allows, I think is in Europe nurses also allowed to do facial aesthetics?
That's a very, very good thing what you said now. In Canada, in England, there are nurses who are doing facial aesthetics. Okay, nurses are doing it to a certain extent. So they can't do, big things. So every area or whatever, maybe they do Botox in the upper facial third, under-correct it, and doctor has to correct it over, but there are rules for nurses, but dentists absolutely do everything. So I don't know any dentist in UK who is doing facial aesthetics and who is just doing perioral area. So we do everything. It just complete. And it is if you think about Asian philosophy of life and everything, which is very holistic, much more holistic than Europe, why you should divide face into this little box out there close to the lips. That's funny, right?
Yeah,
so Zygomatics major and minor, they start here on the zygomatical arch. So are you going to exclude the way the position of startup position of the muscle, even though it's catching up here, right? And with Botox, you have to correct it for gummy smile, zygomatics minor, not major, but minor, yes. So are you really going to forget that it starts here? No. So I think it's a basic logic and just it will come to Philippines, I'm sure. Because smiles start in the eyes, so you have to think about orbicularis ocular muscle when you inject when you want to make a beautiful smile, even though it's not here, even though it's up there.
Okay, so that's it, Dr. Ivona. Thank you so much for answering all our 5 questions. But before you go, please do invite our dental practitioners or even medical practitioners who would like to start with our online program at DMD Center. And of course, do invite them to attend our workshop here at DMD Center. So the floor is yours, Dr. Ivona.
Thank you, Dr. Jean. I'm truly delighted to come to Philippines. I can't wait, honestly, because I'm Asian in my heart. I was living so long time in Hong Kong, and now I'm out of Asia for nearly 3 years. And so I'm super happy to be with you guys soon in December. And I want cordially to invite every one of you who is thinking about facial aesthetics. And I'm sure everyone is thinking about this, because if we don't think, patients think. And it truly changed my life. It totally changed my life, made me happy, made me a fulfilled person. And I'm sure there's so many cases out there of people whom I trained who can tell you the same. So don't hesitate. Step into the world of facial aesthetics before your patient is asking you to do so. Because I had cases where the dentist would come to my workshop saying, oh, my patients want to do lips with me. That's sad. You have to be before your patient. So step into the world of facial aesthetics with us and make your patients even more beautiful.
Okay, thank you so much, Dr. Ivona, for your time. Yes, I know it's too early there, but you provided us your time and knowledge for this afternoon. There you go. Thank you.
Thank you.
So we're gonna see you on December 12th. And
Well,
then, of course, our dockies who are participating in our program will see you on the 13th, 14th, and 15th for the workshop for the full program. Yeah.
Yes.
Thank you
So
so
see you
much,
soon.
Dr.
thank you.
Ivona.
Welcome and see you soon. Thank you for inviting me.
Yes. Bye-bye.
Bye.
Okay. So, mga dockies, we would just like to share with you, okay, our program at DMD Center. This is quite a big work, or what I can say is dream for Docky Brian and I, this dental enhancement skills class, because in order for us or be a part of the upliftment of the quality of health in our country, it will all start with developing the skills or enhancing the skills of the health practitioners. And one of the health practitioners that are really involved in the general health of mga mamaps and pop-ups are the dentists. And that is why at the MD Center, we are offering different kinds of programs. We have the orthodontics, and of course, we also have marketing and other things that hopefully at a later time we will be able to offer online and be able to share it with a lot of dentists who would like to develop more or make their skills better than what they started with. Ayan. So hopefully, mga dockies, you will do support DMD Center, Usapang Dentista, our channel, and of course, this Dental Enhancement Skills class, or DESC for short, for the dental practitioners. Ayan, Doki, please do invite and say thank you to all who did watch our program this afternoon.
So yes, Doctor, I would like to thank everybody who spent their time with us, na talagang ang dami na natutunan kay Dr. Ivona. Sobrang natuwa ako, ang dami niyang sinigot na questions, and alam mo yun, nakaka-excite talaga na Dr. Ivona is coming to the Philippines. And I really love it that he's trying to inspire and help uplift the quality of healthcare in the Philippines. Anyway, I also want to invite in AADS, Doctora, and sana they come to there para makita nila how does Dr. Ivona do her lectures and her workshop para sana mas maraming ma-enganyong mag-aral ng aesthetics. More than that, thank you everybody and see you on December.
Okay, bye-bye. Salamat mga dockies, mamams, and papaps. Bye-bye.
Bye-bye.